Hello everyone, welcome to the second segment of hydrotherapy, and here we're going to talk about basic hydrotherapy or whirlpool type equipment and also the indications, precautions, and contraindications for warm whirlpool. This is a picture of a Hubbard tank. These are pretty rare, but this would be an example of a tank in which someone would be immersed full body. You can see the green stretcher that's angled down into the tank. Obviously there's no water in the tank. So this yellow gizmo here that's hanging from the ceiling, this actually goes on a track, and so what would happen is the person would come down on a cart, and you can see the edge of the cart here in the right hand corner. They would be lying on top of that green stretcher, which would be placed on the cart, and then there are 4 different connectors that go onto the 4 corners of the cart, and you would actually lift the person up, slide them over on a ceiling track, and then you would lower them into the hydrotherapy or the Hubbard tank. And then the top section of the cart hooks onto this gooseneck kind of apparatus here. So again, not a tank that you're likely to see. However, this tank has a lot of the other features that you definitely will see in a typical hydrotherapy tank. So first of all, a thermometer, which is really important. That lets you know the actual temperature of the water that's in the tank. Most big tanks like this will also have a temperature gauge on the water supply, and you can see that over here, kind of in the upper, kind of in the middle and the back of the picture. So as you're actually putting the water in, you can adjust the hot and cold so that you are putting the right water in, but then of course ultimately you'd have a temperature gauge here. You can see these big red things here. These are the turbines. There are 2 of them on this tank, and they can slide around on this track here, so they can go these agitators have little motors in them, and they control the speed of the water, so that's what creates the turbulence for the hydrotherapy. This is another example a little closer up of the turbine, and so any whirlpool tank, regardless of the size, is going to have something that circulates the water, and they all pretty much have this basic design. So again, the motor would be up here, and we have a small portable tank, and I'll show you a picture of a similar one in a second, but it has a little on-and-off switch on top, and has a way that the water is going to come in and get circulated. It's also going to take air in, and it then will circulate that water. There are 2 ways that you can control the speed of that water coming out, or the level of turbulence, and the main way is with the throttle here, and that controls the speed of the motor. But the other way is to control how much air and water are actually being come out, and that's through a little butterfly valve here. There are tanks that you can't quite fit your whole body in, but you can fit a lot of your body in. These are called Highboy tanks, and this is looks like a pretty typical athletic type setting, like you might find in a high school or a college gym area or sports area, where the person can sit up here and put their feet in the water, or they can sit here and put their feet in. Some of these tanks have a seat that you can actually sit in that lowers the person into the water here, so you could get the person up to about chest high or so. So different forms of hydrotherapy, but mostly for the majority for the lower extremities. And again, you see the turbines here and the temperature gauge and things like that. What you can't see here is these would have a drain in them so that you could drain the water out. This is called a lowboy. This is kind of like a big bathtub. There's a little seat in the bottom. Again, you can't see that, and but the person would actually get in and sit down just like they would in a bathtub, and so again you could be submerged down to about chest level. This is probably more typical now of what therapy departments have available. This is a portable foot whirlpool, or you could use it for the hand, of course. Again, just a small turbine. It's on wheels, so you can move it around, so it doesn't have to have dedicated plumbing. You have to be able to fill it up with a hose, but it doesn't have to be in a special room with dedicated plumbing. And then there's a way to pump the water out. And so again, we will be showing you how to use that, our portable tank that we have, and instructing you in all of its operational needs. All right, that pretty much does it for different types of equipment. I want to go through indications, precautions, and contraindications. And we'll just start with indications, and these are for warm whirlpool. So for warm whirlpool, we would use hydrotherapy for subacute or chronic, traumatic, or inflammatory conditions. So you should be getting pretty comfortable with that. We can put people into a whirlpool to treat a contracture. So just like we would for any other warm modality or heat modality, it increases the extensibility of connective tissue. Traditionally, physical therapy used hydrotherapy extensively for treatment of open wounds, and our science of how open wounds should be treated and what's good for them has changed a lot over the years, and so we don't do it nearly as much as we used to. It used to be that pretty much any open wound went into a whirlpool, and we've come to learn that that's not perhaps the most beneficial way to treat a wound. And so some of the benefits are, of course, that it can cleanse the wound. So if there's, let's say somebody's got a big road rash kind of a thing, or if they have necrotic tissue, you can clean out that wound. And a clean wound, a wound can't heal unless it's clean. So that's a really important thing. A wound can't heal if it's really dried out. So we could also use that as a way to moisten a dry wound. Infected wounds can benefit from hydrotherapy, again from the cleansing. And then the warmth, of course, can increase circulation and promote healing and cleaning out of metabolic waste. And if you see up here on the diagram here, the immersion means that the body is being put into the tank. Again, we can clean out the wound. It softens necrotic tissue and removes debris. Debris and necrotic tissue are what bacteria feed on, and bacteria, of course, too much bacteria could lead to an infection. It also would prevent epithelialization, which means skin growing over the wound, which is how the wound heals. The pressure and the heat, again, can increase circulation, and that also can foster healing. So these are definitely the benefits. However, we want to be careful that we would only use this on a wound that had 50% or more necrotic tissue, if that was the purpose, because the turbulence that cleans off the necrotic tissue could also be enough to damage the very fragile, clean, new tissue that's being developed. So the risk-benefit would not be present if there wasn't more than 50% necrotic tissue that we were trying to get rid of. In addition, we want to make sure that we would use this for deeper wounds. So if we think about our 4 layers of tissue, epidermis, dermis, subcutaneous tissue, and muscle, tendon, bone, we would use this for wounds that penetrate only to the 2 deepest layers, the subcutaneous tissue and the muscle, tendon, bone level. More superficial wounds wouldn't require this and probably wouldn't benefit necessarily from this. All right, another indication is muscle spasm. Again, not spasticity, but muscle spasms, and we know that heat can interrupt the pain spasm cycle. If you don't remember that, then you should look back at our pain spasm cycle and see how that might occur. But some hints are, of course, by heat's effect on the muscle spindle, its effect on circulation, just to name a couple things. Kind of a different indication is muscle weakness, and because of the buoyancy of water, we could help someone exercise within a whirlpool, and then that promotes increased strength. You might remember for peripheral vascular disease, it's actually a contraindication for application of a hot pack, because if we put a hot pack over, say, a person's legs who has PVD, the tissue would not be able to react enough to prevent a burn. So in this case, we would put the whole person in the whirlpool, and the generalized increase in heat would cause an increase in circulation throughout the entire body, without putting any one area at risk for a burn. So that would be the potential benefit for someone with PVD or peripheral vascular disease. I'm sure you've all experienced the relaxing nature of a hot bath or a whirlpool. for tension and anxiety. So we know that heat has an impact on it diminishes the activity of the sympathetic nervous system, and so part of that can create vasodilation, but other parts can also relieve tension and anxiety. And then finally, ascites. And I know that's kind of an odd word, not one you may be familiar with, but this is when fluid accumulates in the abdominal cavity. And we see this in people who've had lymphatic obstruction. Often we see it in people with liver conditions, liver failure, cirrhosis, somebody who's waiting a liver transplant. It blocks uptake of the it blocks the hepatic vein, and so all that fluid kind of backs up and accumulates within the abdominal cavity, and you can tell that looks really uncomfortable. Typically, medications don't work that well because it's a physical blockage, and so we can't really use like a water pill or a diuretic to help them get rid of it, but we can use the hydrostatic pressure as a way to force it back into different areas of the venous system. Then it can go through the kidneys and be eliminated. And honestly, I don't know how much this is done anymore. When I first graduated, I worked in a hospital where they did a lot of liver transplants, and so we had a lot of people who were very ill and had ascites, and also with liver problems, of course, they don't tolerate taking medications. So we would have people come in, and they were called floaters. They would come in and sit for an hour, hour and a half at a time in the whirlpool, and the hydrostatic pressure, again, promoted the kidney elimination. And so we saw some pretty effective results with this, and people were certainly a lot more comfortable. So that's ascites. So just in summary, for our indications, you can see subacute and chronic traumatic and inflammatory conditions, tissue contractures. The next one is arthritis. I would put that up with subacute and chronic inflammatory condition. Post-fracture I would put with a traumatic condition. Open wounds and burns we talked about. Muscle spasms, muscle weakness, and tension and anxiety. So it goes through all the therapeutic effect and the different properties of water that can help that. So I just give that to you as a good reference slide. So this is one of those slides. If you can explain everything on here, then you are in great shape. I don't have any slides for precautions, so I'll just run through those with you. One precaution is patient confusion. Particularly if you're going to put someone in a full body tank, you definitely want to make sure you have someone who can follow directions and doesn't get agitated or isn't confused by what's going on. We'll see when we talk about safety, we always want to make sure we monitor someone anyway, but that's the reason for patient confusion. While we have a temperature gauge, we still want to get feedback from somebody on if water feels too hot. We know that people have varying levels of heat tolerance, and so what might feel comfortable to one person might be too hot for somebody else. If someone has a skin condition, a dermatological condition, we just would check with the physical therapist or the doctor on whether or not it was safe to put them in there. So let's say you have someone with psoriasis and you want to do a whirlpool because they've had a muscle strain. You just want to check and make sure it's not going to make their psoriasis worse. Pregnancy is a precaution. The reason for that is that we don't want to have an increase in core body temperature for a woman who's pregnant. There are indications that that has negative effects on the development of the fetus. So if we thought the core temperature would be increased, we would not put a pregnant woman into a whirlpool. But if it was a local whirlpool and we didn't expect systemic increase in core temperature, then it would be fine. Respiratory insufficiency, we talked about this in the previous video, the fact that the water can increase the external compression on the chest and make inspiration or inhalation difficult. So the reason it's in precautions is if their chest isn't immersed, it wouldn't be an issue. And then if a person is incontinent, in other words, they don't have bowel and bladder control, then we would not want to put them into the whirlpool if their pelvis was immersed. So again, foot, hand, that would be fine, but not whole body. Finally, we have 5 contraindications. Cardiac insufficiency, again, this goes back to the heart needing to beat harder with the vasodilation that occurs. Fever, of course, if the person's core temperature is already raised, we wouldn't want to risk raising it more by immersing them in water. Acute conditions, because we are talking about warm whirlpool. Remember, if you're treating someone in a cold whirlpool or immersion, we would use the cryotherapy indications, precautions, and contraindications. Cancer, we don't want to use heat as a way to increase circulation and possibly either facilitate growth of a tumor or move cancer cells around from one part of the body to the other. And then finally, active bleeding, the vasodilation that heat promotes, as well as the thinning of blood, would promote even more bleeding. So this slide just gives you a summary of contraindications and again, some of the rationale for them. So this is the end of this section, and you have another section on hydrotherapy that will cover dosage, and also we will go into some aquatic therapy, and then finally some safety considerations. So thanks for your kind attention, and we'll be talking to you soon in the next installment.